Congenital anomalies of aortic arch. I am Dr. Sarita, Professor of Anatomy. I will be discussing in detail about the congenital anomalies of aortic arch. Congenital anomalies of aortic arch arteries is referred to abnormal embryological development. Congenital anomalies of aortic arch arteries will be discussing in under number of subdivisions. Coming to the first part, abnormalities of branching of arch of aorta, aberrant origin of right subclavian artery, abnormal left aortic arch artery, that is the coarctation of the artery, bovine arch and left vertebral arteries. These are the common type of anomalies. There are numerous anomalies, but we'll be discussing the most common type of anomalies. Right subclavian artery arises from the arch of aorta below the left subclavian artery. It crosses behind the esophagus to reach the right arm and may cause difficulty in swallowing. Right subclavian artery arises from the arch of aorta. The aberrant right subclavian artery is a rare anatomical variation. Embryologically, it's mainly because of disappearance of the segment of right dorsal aorta cephalic to the seventh intersegmental artery and the right fourth aortic arch artery. It's usually commonly seen in patients with trisomy 21. Aberrant origin of right subclavian artery is associated with right recurrent laryngeal nerve, which usually hooks round the right subclavian artery. Normally, because of the absence of right subclavian artery on the right side, the recurrent laryngeal nerve is now known as non-recurrent laryngeal nerve and it enters the larynx directly. This aberrant origin of right subclavian artery can run behind the esophagus in 80%, between esophagus and trachea in 15%, sometimes anterior to the trachea in 5%. Anomaly may be associated with dyspnea and dysphagia, but majority of the cases of aberrant right subclavian artery are asymptomatic. Abnormalities of branching of arch of aorta. More than 20 different aortic arch configurations have been described, but we'll be discussing the most common type, this, the bovine arch, where the left common carotid has a common origin with the innominate artery or brachiocephalic trunk rather than arising directly from aortic arch as a separate branch. Bovine arch can be associated with increased risk of embolic stroke. The next common type of anomalies is a left vertebral artery arising from directly from arch of aorta between the left common carotid artery and the left subclavian artery. Vascular variations are usually asymptomatic. They may become important in patients undergoing endovascular interventions or surgical procedures. The fourth type related to the arch of aorta is the coarctation of aorta, which has three types. It's basically defined as the congenital narrowing of arch of aorta distal to the origin of left subclavian artery. Coarctation are most common with the arch of aorta. Coarctation of aorta are three types, results in the decreased blood flow to the lower part of the body. The three types are preductal, paraductal and postductal. And the X-ray showing the coarctation of aorta, a figure of 3 sign. The first type is preductal type of coarctation, which is commonly seen in infants. It's also known as infantile type. It's 5%, and it is narrowing of aorta proximal to the ductus arteriosus. Ductus arteriosus, which is distal to the left subclavian artery. Ductus arteriosus will remain patent to maintain the circulation of the lower part of the body. Preductal aortic coarctation is less common, present in 5% of infants with Turner syndrome. Ductal coarctation, the narrowing of occurs at the insertion of ductus arteriosus, a severe type of coarctation of aorta and a critical congenital heart defect. The postductal coarctation, the narrowing is in the distal to the insertion of the ductus arteriosus below the left subclavian artery. Even with open ductus arteriosus, the blood flow to the lower part can be impaired. This is an adult type of coarctation, most common in adults. Postductal coarctation is usually associated with collateral circulation. The hallmark of aortic coarctation is significant difference in blood pressure between the upper limb and lower limb, hypertension in the upper extremities and weak pulses in the lower extremities. A physical examination often reveals elevated blood pressure in the upper extremities and diminished in the femoral pulses as compared to the radial or brachial pulsation. Coming to the coarctation of aorta, the X-ray findings radiologically, these patients with aortic coarctation, a figure of 3, pre or post stenotic dilatation of the descending aorta forming a figure of 3 sign. The second X-ray is barium meal of the esophagus, shows reverse 3 or E sign. The third radiological feature is the rib notching between the fourth and the eighth ribs. This finding is the result of increased collateral flow through the intercostal arteries. Coming to the abnormalities of arch of aorta, right aortic arch, cervical arch and coronal diverticulum, which is related to the right arch and the left arch. The right aortic arch is a mirror image branching. Right subclavian artery and right common carotid artery arise as directly from the right aortic arch artery, whereas the left subclavian and left common carotid arises from brachiocephalic trunk, which runs usually anterior to the tubes, trachea and esophagus, and can cause a vascular ring and compression. Ductus arteriosus connects the left pulmonary artery with the arch of aorta beyond the origin of left subclavian artery. Coming to the embryology of right aortic arch arteries are persistent, abnormal persistent of right dorsal aorta, normal involution of distal part of left dorsal aorta, and persistent of the dorsal part of sixth aortic arch. Right aortic arch shows no lasting effects of condition, usually detected around 20th week screening by ultrasound during pregnancy. Right aortic arch, the heart condition in which the aortic arch develops on the right side. The left fourth aortic arch and the left dorsal aorta is obliterated and replaced by corresponding vessels. The most important here is The ductus arteriosus connects the left pulmonary artery with the right aortic arch beyond the origin of right subclavian artery. Three types of right aortic arch arteries are present. They can be associated with congenital heart disease, vascular rings, chromosomal abnormalities such as T-Josh syndrome. Type 1, the right aortic arch artery showing right subclavian artery, right common carotid artery arising directly from the arch of aorta, whereas the left subclavian artery and the left common carotid artery arising from brachiocephalic trunk. Type 2, right subclavian artery and right common carotid artery and left common carotid artery arising from the arch of aorta, and left subclavian artery arising from the arch of aorta beyond the origin of right subclavian artery and crossing from right to left. The third type, right subclavian artery, right common carotid, left common carotid and left subclavian artery, all of them arising from the arch of aorta and left common carotid, and you can see the left subclavian artery is connected to the left branch of pulmonary artery by the ductus arteriosus. The cervical aortic arch is a rather rare congenital anomaly where there is abnormal elongation of aortic arch to the neck above the medial end of the clavicle. The cervical aortic arch develops most likely from the persistent embryonic third aortic arch instead of fourth. The important branches which arise from the cervical aortic arch are the right common carotid, right subclavian artery, left common carotid, left subclavian artery. X-rays showing the radiological features of cervical aortic arch artery. Humeral diverticulum, a developmental anomaly of the aortic arch. The diverticulum arises either from left or right aortic arch with the aberrant subclavian artery on the contralateral side. This is mainly due to the persistence of remnant of fourth dorsal part of aortic arch. This anomaly can be asymptomatic of features of tracheal and esophageal compression. Left aortic arch showing the humeral diverticulum and from which arising the right subclavian artery. Right aortic arch artery, where we can see the left subclavian artery and apparent origin from the humeral diverticulum. Coming to the supernumerary arches, the double aortic arch, persistent ductus arteriosus, persistent fifth aortic arch, persistent ductus arteriosus, ductus caroticus, interrupted aortic arch. Double aortic arch, embryologically failure of regression of right dorsal aorta leads to the double aortic arch. Double aortic arch is the most common type of vascular ring malformation. The vascular ring surrounds the trachea and esophagus, compressing both and causing difficulty in breathing and swallowing, dyspnea and dysphagia. Double aortic arch forming a vascular ring. Usually the right arch is posterior, gives rise to right subclavian and right common carotid. The left arch is anterior, gives rise to left subclavian and left common carotid. Double aortic arch been divided into three types. Type 1, large right posterior arch and small left anterior arch, known as right dominant aortic arch, which accounts for 75%. Type 2, small right posterior arch and large left anterior arch, is described as left dominant aortic arch, which comprises of 20%. Equal diameter of dorsal double aortic arch, a balanced type, right and the left, which accounts for 5%. Double aortic arch may be clinically silent or manifest symptoms due to the compression of trachea and esophagus. Computer topographic scanning is currently a diagnostic procedure and choice for vascular ring. Radiological pictures showing bilateral aortic arches at the level of aortic arch, right the large arrow, the left is a small arrow. Treatment is mainly by surgical remain, which is a mainstay. Persistent ductus caroticus. The anomalies related to the persistent ductus caroticus, the left internal carotid artery arises from the arch of aorta and right internal carotid artery arises from the right subclavian artery. It can be correlated with absence of common carotid, and external carotid artery may also arise from arch of aorta. Persistent fifth aortic arch artery can be unilateral or bilateral, and it can be present in the various clinical types. Wernberg's classification is commonly used in clinical practice to categorize persistent fifth aortic arch artery on the basis of abnormal vascular connection. Type A showing double lumen of aortic arch, type B showing a single lumen of aortic arch, and type C showing the pulmonary artery continues with a descending aorta. Patent ductus arteriosus. Neonate ductus arteriosus fails to close after the birth. Failure of closure of ductus arteriosus, that is the dorsal part of sixth aortic arch on the left side, mostly in premature infants or infants born with mother with rubella during the first trimester of the pregnancy. Patent foramen ovale, right to left shunt, and it leads to the cyanosis of the baby. Diagnosis is on auscultation, continuous missionary murmur on the left infraclavicular region. Interrupted aortic arch. Physiologically, there is a gap between the ascending aorta and descending aorta. Embryologically, it is mainly due to the obliteration of right and left fourth aortic arch arteries, which leads to the interruption of the aorta. Interruption of the aorta are also four types. Type A, interruption occurs between the left subclavian artery or just after the left subclavian artery. Type B, interruption is between the left common carotid and left subclavian artery, which is the most common form of interrupted aortic arch. C type, interruption between the right common carotid and the left common carotid. And D type, interrupted aortic arch, is between the left common carotid and left subclavian artery with the right subclavian artery, which arises beyond the left subclavian artery. Defect is usually accompanied by ventricular septal defect or patent ductus arteriosus, allowing the blood to reach the lower part of the body. Anomalies they finally related to the truncus arteriosus, which mainly gives rise to the aortic arch and pulmonary trunk. These are closely related to the cardiac anomalies, but we will take up its anomalies because it's closely related to the aortic arch arteries. The persistent truncus arteriosus, transposition of great vessels, corrected transposition of great vessels. Persistent truncus arteriosus, failure of migration of neural crest cells which are responsible to form the spiral septum and which leads to the absence of spiral septum to divide the truncus arteriosus into ascending aorta and pulmonary trunk. Most of the time this defect occurs spontaneously mainly due to genetic disorders or other teratogens. In truncus arteriosus, there's one arterial trunk arises from the heart providing mixed blood to the coronary arteries, pulmonary arteries and systemic circulation. Transposition of great vessels. Spiral septum follows a straight course instead of spiral course. Aorta arises from the right ventricle. Pulmonary trunk arises from the left ventricle. Detransposition of great vessels, common cyanotic defect mainly due to the abnormal migration of neural crest cells, life-threatening congenital condition present at the birth. Mainly it's due to the lack of sufficient blood flow or ischemia or oxygen flow and leading to the hypoxia to the brain. Corrected transposition of great vessels LTG not associated with the cyanosis, and it is mainly due to the abnormal ventricular positions. Here the right atrium is connected to the left ventricle and the blood from left ventricle flows into the pulmonary trunk. Left atrium is connected to the right ventricle and the blood from right ventricle flows to the arch of aorta. Embryologically, heart twist abnormally while development, leading to ventricular arterial discordance. Right ventricle is connected to systemic ventricle. Right ventricle acts as a systemic ventricle and is bound to have difficulty in tackling the systemic pressure in the later part of the life. Aortic vascular rings, congenital condition involving the aorta and its branches mainly surrounding the trachea and esophagus forming a ring and compressing the trachea and esophagus or both causing difficulty in breathing and dysphagia. Only treatment of vascular ring is surgery. One of the commonest causes double aortic arch. The other thing is left aortic arch where we have aberrant retroesophageal right subclavian artery which goes behind the esophagus. The third most common part of forming the vascular ring is in a right aortic arch where we have abnormal retroesophageal left subclavian artery. Normal left-sided aortic arch, normal right aortic arch which is a mirror image. Double aortic arch with bilateral ductus arteriosus. Double aortic arch forming a ring encircling the trachea and esophagus and the ductus arteriosus. Diagnostic methods of aortic arch anomalies are most common is barium esophagography, primarily diagnosing the arch anomalies. Angiograph may become a gold standard In the recent years is a MRA and CT scan supplemented by angiography as a gold standard for definitive diagnosis of arch anomalies. Thank you very much.